Folks, thanks for coming on with us today. My name is John Dubas. I'm a Vice President of Agent Success with Premier Marketing, and we'll be spending the next hour or so learning more about the options that you have with Medicare products with UnitedHealthcare in the state of Texas. UnitedHealthcare is a valued partner for just about anyone who works in the Medicare space, and their presence in Texas is rather dramatic, rather powerful, and rather persistent throughout the years. It's a program that has come a long way since the mid-'80s when a predecessor company called Secure Horizons began operating in the city of San Antonio, and then has grown to the monster that it is across the country. I'll do a little bit of housekeeping to start with. Today's presentation is being recorded and will be available for all who have expressed their interest in this presentation, and will be sent to you by email with follow-up by the agent success managers that we have here with Premier Marketing. A bit of housework as well, or housekeeping as well, is the fact that this information will come to you with other key components that can help make you successful this AEP and beyond. A little bit of information about Premier Marketing itself. We are a national marketing organization founded in 1968. That's part of the Integrity Marketing Program, the platform that has offices across the country. We're an insurance wholesaler offering insurance programs through different carriers in conjunction with independent insurance agents across the country. Those contracts are made available at the highest possible commission levels, with recruiting contracts available for those who qualify. As I mentioned, we were founded in 1968, so that does mean we are celebrating our 50th anniversary this year. It's a great accomplishment for a family agency in a small town in Nebraska to grow into the marketing juggernaut that it is at present, because we are the largest producer of Medicare Advantage programs with UnitedHealthcare, with Anthem, and with Meridian across the country. It is also an opportunity we have to be one of the top producers with other of the national carriers and many other regional programs as well in the Medicare Advantage space. I mentioned we're part of the Integrity platform. We do have offices across the country. Premier Marketing's home office is in Norfolk, Nebraska. I'm speaking to you from the Dallas, Texas office at the Integrity Marketing Group headquarters. We do offer a full insurance portfolio, including Medicare programs from the gambit of the different Medicare Advantage plans, Medicare Supplement programs, and Part D prescription drug plans, with also a full portfolio of life insurance and annuity products, including final expense and pre-need, long and short-term care products, disability income programs, and ancillary plans with a multitude of companies offering dental, vision, and hearing programs, critical illness and cancer plans, and hospital indemnity programs as well. That full Medicare Advantage portfolio is inclusive of all the big boys in the industry and a large number of the regional carriers that aid in your success in your particular market. We also offer a very large portfolio of PDP programs, not only with the carriers that offer MA plans, but also with folks that are offered from a standalone program as well. Our Medicare Supplement portfolio is very large, very extensive, and covers a number of opportunities across the country that gives you the opportunity to be at the forefront of the market in your particular area as well. When we speak of the Medicare market overall, it is important to note that it is a huge component of our society. Everyone speaks to the baby boomers aging in and the opportunity they bring to us, over 10 million people a day. There's actually over 10,000 people a day. There are actually over 11,000 people a day accessing Social Security benefits. And if you look at the Medicare market overall, you need also to take into consideration that about 1/6 of the people accessing Medicare health benefits are under the age of 65 and are eligible for that coverage because of a disability, either physical or mental. We are in a unique situation in our country as well, as many people are choosing to work past the age of 65 and have coverage elsewhere. So there are differing numbers that come into play when we speak to the market overall, but it's a huge opportunity for us as insurance agents. A number of the folks that we deal with have certain common characteristics. Folks that are on Medicare generally have multiple chronic conditions. The majority of the people are under the median income for a person on Medicare now is $26,200. There's a large number of folks that are even lower income than that, and it gives us an opportunity to address certain circumstances with a multitude of different products, because as we can see by the various characteristics of the Medicare population, it's very unlikely that any one product would be the perfect solution for all that are part of that population. And one of the advantages you have with a huge carrier like UnitedHealthcare is the fact that you have product that is available to you for sale year-round, because a large number of the folks that are on Medicare, even though they may be subject to certain enrollment restrictions, well, there's sales happening all year round. When we go into 2019, there are some legislative challenges that come into play. The Medicare Advantage open enrollment period begins in 2019, so the Medicare Advantage disenrollment period goes away. And that was a program that we've had over the last few years that enabled someone to drop a Medicare Advantage program in January up until Valentine's Day. The new program comes into effect at the first of the year and is a Medicare Advantage open enrollment period that is available through January, February, and March. And this is an opportunity for folks who are enrolled in a Medicare Advantage plan to have a one-time opportunity to do a number of things. One, they could switch to a different Medicare Advantage plan should they choose to do so. They could drop their Medicare Advantage plan and return to original Medicare Parts A and B, and with that disenrollment, have an opportunity to enroll in a standalone Part D program. And if they chose to do so, if they had a Medicare Part D plan, they could drop that during this time period as well. One of the changes that comes about in 2019 as well is a change to the dual LIS special enrollment period, where in the past, this SEP was available monthly. That will no longer be the case. This special election period will now be quarterly through the first 9 months of the year, plus changes during AEP. And this SEP is not available to those who are identified as at risk or potentially at risk for prescription drug abuse under drug management programs. So some of the things that we're going to see in 2019 are programs that are not yet available to the public. These are filed with the government, not totally approved, and so they are subject to change. And the information that is part of today's presentation is the confidential property of the carrier exhibited, UnitedHealthcare, and it's for agent use only. The presentation is not intended for use as marketing material for the general public, and if you do so before the 1st of October, you are subject to severe ramifications up to and including the carrier pursuing your license to sell insurance. So don't do it. When you look at the UnitedHealthcare portfolio of products that's directed at the Medicare population, it includes Medicare Advantage plans that fall into the so-called traditional Medicare Advantage prescription drug plans. You will see Medicare Advantage plans that do not offer medication coverage integrated into the program, and you also have different special needs plans available through the brokerage population. And that includes a D-SNP program, a dual special needs plan targeted at folks who have both Medicare and Medicaid. You have a C-SNP program, a chronic special needs plan that is directed toward folks with certain chronic illnesses. They do offer an I-SNP plan, an institutional special needs plan, but it is only offered through certain employed individuals, and so not listed on this portfolio. They do offer the largest Medicare supplement plan in the country when it comes to membership, and that is through their association and underwriting of the AARP prescription drug plans. And they have a very large share of the Medicare Part D prescription drug plans that are also labeled or logoed with AARP. In Texas, you have a tenured and experienced sales leadership team across the state, and you'll notice that these folks, the majority of them, have actually been in the field as well. Texas overall is a very important market to UnitedHealthcare, and one of the obvious reasons is, well, hey, it's got a huge amount of eligibles. Over 4 million people on Medicare that are eligible for one product or another, including over 600,000 people that are eligible for their D-SNP product. Year-over-year eligible growth is very strong. The market penetration with an MA product overall actually runs behind some of the other states in the country at 29%, where the year-over-year MA enrollment growth, however, is working to catch up. When you look at this penetration of Medicare Advantage product in the state of Texas, you see that UnitedHealthcare has a very healthy share of it at 41.9%. However, if you have market penetration of 29%, that means that 71% of that population doesn't have a Medicare Advantage product, so it's still a very strong opportunity, particularly considering the fact if you look at this map, you've got a UnitedHealthcare Medicare Advantage product available in every county in the state of Texas, and it's a big state. When you look at the management team here in Austin, they help you work through the opportunity you have in this strong market, where they are the largest MA plan in the market with a 38.7% share. The products are very stable year over year. It's a strong portfolio of products across the board with HMOs, local PPOs, D-SNP HMOs, a regional PPO. You've got the MedSup and Part D plans in there as well with additional SNP products, expanding into Bastrop County for 2019. And it is an opportunity because of some of the changes coming about with cost plans offered through Baylor Scott & White, considered a very good opportunity for 2019. It does offer a strong, stable network featuring the WellMed Medical Group and a strong layering of ancillary benefit into the base medical coverage. So you've got a good opportunity with a lot of product and a lot of local support for you. When you look at the eligibles themselves, there's over 250,000 people that are eligible of Medicare. The growth year over year is very strong. MA penetration non-SNP is very low, so there's a lot of folks to talk to, and United has about a third of that penetration in the Austin market. You have 3 different plans available, 2 HMO programs, and a newly available local PPO program that gives you an opportunity to offer choice across the service area. And you'll notice that as a whole, the benefits have held strong year over year, with actually the inpatient hospital benefit on the core HMO program improving, with a slight change in Tier 4 prescription coverage, which is still stronger than we see in very many of the other markets across the state. When you go down to the coast and you speak of the Corpus Christi market, you have folks there that are in place to help you market, and it is an area where UnitedHealthcare and AARP brand recognition is very strong, with being the largest MA plan in the market with 54% market share. There are additional counties for expansion for the MAPD product. The DSNP program offers strong year-round sales. The benefits are very stable. The network is strong. You have a nice ancillary package for additional benefits in the market and folks there to help you. Look at the eligibles. There's nearly 117,000 people on Medicare in this market. That is still, if you look at it on a national basis, underpenetrated for MA products, with UnitedHealthcare having the majority of that penetration. So they know what they do, and it's there for you to market. There are 3 plans available here as well, and you see that the benefits have held strong year over year with 0 premium, strong co-payments, and overall benefit package that's very appealing to the Medicare population. When you go out west into the El Paso and southern New Mexico market, you have a strong contingent of employed assistance for you in the market, with a very strong program in El Paso as well, where UnitedHealthcare is the largest MA market in El Paso with 51.5% market share. Core benefits that remain strong year over year, a strong network with a number of asked for and demanded ancillary product, and a lot of local feet on the street to help make you successful in this market. It is an area that has nearly 260,000 eligibles, with a small penetration in the MA market, 15.9%. It is an area where UnitedHealthcare has a good share of that market, but a lot of room for growth. And for folks who are committed to year-round sales, it is also a very strong DSNP opportunity. Benefits hold very strong year over year, with a decrease in their max out-of-pocket to a very competitive $4,500 a year. A number of additional benefits that are available for you in the regular MA program. You'll see once again where benefits have held strong, with 3 different options available for you in this market. We also have in this market a new dual program specifically designed for folks with Medicare and Medicaid on a local PPO platform. And this goes into the New Mexico market, so a strong point for going across the state border. When you go into the Houston market, you're talking about one of the largest Medicare markets in the country, and United has invested in personnel to help make you successful in that market. It is an area where United has had a long time presence, very strong star ratings, a full portfolio of products. They're the overall market leader at nearly 24% market share. Star rating, as I mentioned, very strong. Largest network in the Houston market with strong ancillary benefits, and as evidenced in the prior slide, a lot of feet on the street to help make you successful. It's a huge market. Nearly 1 million Medicare eligibles. The overall penetration into the market is still relatively small if you consider over a fourth of the Medicare beneficiaries already in an MA plan, but it's an area where United has had a strong presence and continues to do so year over year, with benefits that have held steady from 2017 into 2018. When you go into North Texas, you're also looking at a very large market with a lot of feet on the street for you here as well. This is an experienced team that has a lot of opportunity across northern Texas, because North Texas encompasses 66 counties, and it is the largest MA plan in the market once again too, with a full portfolio of products, strong star ratings, a massive provider network, and strong ancillary benefits as well to help differentiate this carrier from the competition in the market. We mentioned Houston being a very large market. This encompasses a few more counties than what we had featured there, but this is over 1 million Medicare eligibles. And you see that MA in the non-SNP market, there's less than a quarter penetration, even though UnitedHealthcare has the lion's share of that penetration at 61.2%. Once again, you see the plans flat year over year. That's awesome. You don't have to resell your current book of business. Obviously, you want to revisit, and it gives you an opportunity to perhaps cross-sell other ancillary products, but it's a great opportunity for your folks to know they've got their doctor in the network and they got the benefits that they can afford to use year over year. If we go down into the valley, we have strong feet on the street support as well, and a program that is expanding into Starr County, which is an additional 12,000 members, and great portfolio of products that makes for year-round sales, a strong, stable network, exclusive to the WellMed medical group. All the key hospitals are in plan. You also have, of course, the strong ancillary benefits across the board, in addition to the base medical, and an opportunity to make a difference to almost 250,000 Medicare recipients in that market. It's not highly penetrated with MA product, and UnitedHealthcare has over 28% of that penetration. So you have folks that will recognize the name. They have the network of providers to access for a strong plan benefit that has once again held very strong year over year. So you're not seeing an up and down benefit portfolio or benefit package that you need to explain year over year. When we go into San Antonio, you once again have a large number of folks that help you as feet on the street. And it is the largest MA plan in San Antonio with 53.8% market share. I mentioned at the top of the presentation that UnitedHealthcare and the company they purchased have been in this market continuously since 1985, the only carrier to do so. And it is an opportunity in San Antonio where everyone knows UnitedHealthcare and the AARP brand, and they have a strong portfolio of products that enable you to market year-round with a strong, stable network, and also key ancillary benefits available to you to help make certain that your folks get what they need. San Antonio is also a grand opportunity because, hey, there's almost 400,000 eligibles in this market. The penetration for MA non-SNP, well, it's less than a third, but of that, UnitedHealthcare has a half of that enrollment. So folks talk about this plan to their friends and their relatives, and it's not a nightlight of Georgia type of opportunity. People know who they are, and their benefits, as evidenced here, remain very strong year over year, with an introduction of a local PPO program in certain key counties in the San Antonio market that enable you additional selling opportunities. When we come up to Waco, we look at an area that is underpenetrated, if you want to consider it that way, with the Medicare Advantage products. When you have a market of over 100,000 individuals, and UnitedHealthcare has about 15% of that market. You have strong plans in the area that have remained constant year over year, and the introduction of a new HMO program with zero premium that can make a difference for you in this market. We go to the West Texas Panhandle area. We've got experienced folks that can help you address your prospects and the opportunity in this market. It is a stable program, once again, with 43% market share, great expansion opportunities. You have the old branded CIP, Care Improvement Plus portfolio that is coming out with a new brand, a large established provider network, those strong ancillary benefits as well, and an opportunity to address in these counties over 60,000 individuals. You see MA has a small penetration when you speak of these counties of a little over 11%, where UnitedHealthcare has a little over a third of that membership. There's an introduction of a new LPPO into 4 key counties in this area, small premium, small co-payments, a very competitive program for the market, and the carryover of 3 stable plans for you to offer. When you look at dual plans for the state of Texas, that is one of the things that differentiates UnitedHealthcare from just about every other carrier, save 1 or 2, where they have, as I mentioned at the start of the presentation, Medicare Advantage opportunities in every county, including dual special needs plans in every county. So it gives you a unique year-round marketing opportunity across the state. The plans vary very little county to county. You have strong extra benefits across the board, and you'll see that the benefits remain very, very stable year over year. One of the things that you also see as well is a strong Medicare Part D offering that you can combine with Medicare Supplement programs of any branding, but the Medicare Supplement program offered by AARP is a very strong opportunity, and it is an opportunity that gives you name recognition and the brand leader in the market. UnitedHealthcare is also very, very forthcoming with marketing support. Their UnitedHealthcare Toolkit is very easy to operate and is an offering of a vast plethora of marketing material already approved for you to use with different products in different markets across the state. One of the things that is new to UnitedHealthcare on a relatively recent basis is the opportunity to use their electronic enrollment system on a remote signature basis. This will really help you manage your time, limit your windshield exposure, so to speak, and give you the opportunity to make the most of the days that are given to us in the open enrollment period, in the annual election period. We went through a large number of slides with a large number of pictures, so you got a large list of folks to reach out to in your particular market. Here's the contact information for those folks. Obviously, I'm whipping through this pretty quickly. You don't have a chance to make notes. Don't worry. The PowerPoint will be coming to you, as will a link to the recording. So, to use a commercial phrase here, but wait, there's more. You have opportunities for support through our organization where you can contract electronically, create a profile in Insurance Bay, and select carriers to contract with. Obviously, you can do that with UnitedHealthcare. We can create also an electronic link direct to UnitedHealthcare that, even as we approach open enrollment, gives you an opportunity to access and contract this portfolio very quickly. We do offer E&O coverage to qualified agents within our organization at a discounted rate. What differentiates this from some of the blanket E&O programs you might see out there is for a very small premium, it covers you with all products from all distribution channels. And so you are, in essence, accessing coverage to make you a true independent insurance agent, where regardless of where your contracting is, you have the opportunity to cover yourself for errors and omission through this program. We also offer a discounted means of keeping your licenses intact with bundles for continuing education starting at very, very reasonable prices through WebCE, and a large number of training programs that are designed to put you in front of folks that are in need of coverage and are in a vital prospect to UnitedHealthcare and the other programs that you offer as part of your portfolio. We do offer electronic means of enrollment. In addition to the electronic means that United offers, we do have additional quote engines for Medicare Supplement and other ancillary programs. And our Medicare Center allows you to access scopes of appointment remotely and electronically, and an opportunity to also remotely enroll with programs that are keyed to your contracting information, so you know that commission payments are as prompt as possible and eliminates a lot of the concern in that area. We do also offer an exclusive program to put your social media marketing efforts on AutoPilot for a small monthly fee. This company actually supplies you with content for Facebook, for LinkedIn, for Instagram, for a number of the different social media avenues that many of us pursue in order to reach out to the general public. Other lead programs that we have, we can supply a custom list of contacts for you butted up against Do Not Call. We help you engage in community-based marketing programs, including retail marketing that includes the UnitedHealthcare program, the Walmart program, CVS opportunities through multiple carriers, and then also not only a sales track for you to follow in dealing with faith-based organizations, but also a means for you to brand yourself with the community as the subject matter expert and continue to market year-long. We also give that same opportunity for different provider marketing pieces that include not just doctors, but also dentists and other professionals that provide the care that are offered through the insurance programs that we market. There are a number of carriers that do generate prospects for you as well. UnitedHealthcare is especially adept at integrating in contracted agents that are shown to be partners to their organization to make certain that lead flow that they have available is directed to those producing agents. You do have opportunities to access lead sources online through the internet. I'd advise caution with some of that when you're dealing with Medicare Advantage and PDP programs, because you have to be able to verify where your lead source comes from. But for some areas, particularly with MedSups, that's a very viable option for you. You also have an opportunity for direct mail support through our organization. It's based on production, but it's a healthy subsidy of a regular mailing program that you can access through one of our 4 preferred lead vendors. We set it up that way simply because the letters that are part of this program have to be compliant, and we exercise every means we can to make certain that we protect you on the back end in that manner as well. What we look to do is earn your business, and I think you'll see as we go through and discuss UnitedHealthcare and other carriers that we have the capability of putting you on track for a very successful annual election period and production on a year-round basis. What's up to you? Well, it's the whole, when all is said and done, more is said than done. We need to make certain that we've created a strong personal marketing plan that suits your purposes, that you have the tools within it, both with the carriers and the marketing support to be successful, and you actively engage in that program in order for you to achieve the goals that you've set for yourself, your agency, and your family. This is the contact information for us here in Dallas. You can dial that 800 number and reach any of us by asking for us by name or dialing in the extension. That 1-800-365-8208 number will also get you in touch with the other Premier Marketing agent success managers that you may have a relationship as well. And we want to make certain that we help facilitate that communication and that we give you access to all the folks that are necessary to help you be successful. That said, we've gone through a lot of information very, very quickly, but what you have today is a peek at the material from one of the largest insurance companies in the world, the market leader in the Medicare Advantage space, and a strong partner for you in the state of Texas and across the country. We'd like to be your partner in that relationship as well. We look forward to visiting with you in the very near future. We wish you a very successful annual election period and time thereafter. And in closing, we also wish you good selling. Thanks so much. We'll talk to you soon.